Let's be real. Being a medical assistant often feels like working two jobs at once. One minute you're rooming a patient, the next you're on the phone with a pharmacy. Then suddenly you're scanning insurance cards, prepping injections, and trying to finish charting from the last three visits. And somehow you're expected to make it all look effortless. If you've ever ended a shift thinking, I can't keep up, you're not alone. Here's why this matters. Nearly 60% of MAs report feeling overwhelmed by the constant switching between administrative and clinical duties. And research shows that multitasking can reduce accuracy and productivity by almost 40%. That means the constant back and forth isn't just exhausting, it's actually slowing you down. Point. But with the right time management techniques, you can create structure in the chaos and protect your energy throughout the day. So let's break down a realistic system you can start using tomorrow. First, streamline your workflow by grouping tasks, not bouncing between them. Every MA knows task switching is where time disappears. Instead of jumping from charting to rooming to phone calls randomly, start using microblocks. When you finish rooming a patient, take 30 to 45 seconds to complete the essential parts of the note immediately. Chief complaint, vitals, meds, and any intake questions. That alone reduces charting backlog. Many MAs say this small shift saves them from staying late because they're not trying to remember details from 10 patients ago. And when it comes to admin work like scheduling or refills, batch them. 2 or 3 times a shift, take 5 minutes to handle all pending messages at once instead of letting them interrupt every clinical task. The goal is rhythm, not perfection. Second, use preemptive prep to stay ahead of your provider. This isn't about guessing, it's about pattern recognition. After working with a provider for even a few weeks, you know their habits. Maybe they always order the same labs for diabetics or the same vaccines for well child checks. Preparing supplies before they walk into the room cuts down your workload later. According to workflow studies, prepping in advance can save up to 15 minutes per hour in a busy clinic. Create a mental checklist: room setup, equipment, patient education materials, and forms. Anything you can prep now prevents a scramble later. Third, protect your time by setting soft boundaries with clarity and kindness. A lot of MAs struggle here because we're trained to help everyone all the time, but saying yes to every request the moment it comes in is one of the fastest ways to burn out. Try using statements like, I can definitely help with that. I'm finishing a rooming right now, so I'll take care of it as soon as I'm done. You're not refusing, you're prioritizing. And most coworkers, even providers, respect that more than you think. Here's the reminder you need. You're not supposed to do everything at once. You're supposed to do the right thing at the right time. Save this if you want to feel more in control of your shift. And remember, mastering your workflow isn't just a skill. It's a form of self-care that makes you a stronger, more confident medical assistant. You've got this.